First signs of early onset dementia, ways to keep brain function healthy. Alzheimer's disease is terrible, it robs us of our loved ones and destroys our memories. But there are things we can do to prevent it from happening. Many signs indicate early onset dementia. Most cases of dementia begin before age 65. By learning how to recognize these symptoms, you can help protect yourself against Alzheimer's disease. I will go over several warning signs that may indicate early onset dementia. Then I will explain why getting screened for cognitive impairment is essential as soon as possible. Finally, I will share tips on maintaining brain health throughout your lifetime. What can cause dementia? Dementia is a brain disease that causes memory loss and confusion. There are many different types of dementia, including Alzheimer's disease, AD, vascular dementia, VOD, and Lewy Body Dementia, LBD. AD is the most common type of dementia. There are several risk factors for developing dementia. These include age, family history, genetics, head injury, stroke, diabetes, hypertension, depression, smoking, obesity, alcohol use, physical activity, diet, sleep habits, vitamin deficiencies, and certain medications. Some studies suggest that there may be a link between exposure to pesticides and the development of dementia. However, this connection is not yet fully understood. Symptoms of dementia. The most common symptom of early onset dementia is forgetfulness. People who suffer from this condition often become confused when trying to remember things. They may ask questions repeatedly and fail to recognize familiar faces. Other symptoms include difficulty making decisions, trouble finding words, poor coordination, changes in moods, loss of interest in activities, problems with balance and walking, memory lapses, confusion. How common is early onset dementia? Early onset dementia is estimated to affect 55 million people aged 65 worldwide. By 2030, nearly 9 million Americans will live with early onset dementia. Familiar tasks with a person with dementia may take longer to complete because they require additional mental effort. For example, someone with dementia might have trouble remembering where they put something. Or they may forget the day or where they left their keys. People with dementia often lose their sense of time. They may believe it has been weeks since they last ate or show up at a party wearing clothes worn months ago. Stages of dementia in the elderly. Dementia is a progressive disease that causes memory loss and cognitive impairment. The symptoms usually begin gradually and worsen over time. There are 5 stages of dementia, each with its symptoms. Stage 1. Mild cognitive impairment, MCI. People who experience MCI may notice mild memory problems, such as forgetting names, dates, or places. They may also forget things like appointments, phone numbers, or where they put items. However, these issues aren't severe enough to interfere with daily life. Stage 2. Alzheimer's disease. Alzheimer's disease is the most common form of dementia. People with this condition often have trouble remembering recent events, making decisions, and planning. They may lose interest in activities they once enjoyed, such as hobbies, socializing, and reading. Stage 3. Vascular dementia. Vascular dementia occurs when small blood vessels become blocked or leak fluid. This damage disrupts normal brain function and leads to memory loss. Symptoms include confusion, difficulty thinking, poor judgment, and personality changes. Stage 4. Lewy Body Dementia. Hallucinations, delusions, and paranoia characterize Lewy Body Dementia. These conditions cause patients to act aggressively toward others and themselves. Patients may also exhibit repetitive behavior, such as repeating words, phrases, or actions. Stage 5. Frontotemporal dementia. Frontotemporal dementia affects the frontal lobes of the brain. Patients typically develop language difficulties, including problem speaking, understanding speech, and writing. Other symptoms include disorganized thoughts, mood swings, and behavioral disorders. Get regular checkups. The cause of dementia is unknown. However, there are ways to help prevent or slow its progression. Doctors recommend regular checkups to identify changes in thinking and behavior that could indicate early signs of dementia. These changes might include difficulty planning activities, paying bills, following directions, completing daily tasks, or making decisions. There is currently no cure for dementia. But doctors say that treatments can improve the quality of life for patients and caregivers. For example, medications may reduce confusion or agitation, physical therapy can strengthen muscles and balance, and occupational therapists can teach older adults new skills such as cooking, dressing, and grooming. Keep yourself active. Keeping yourself active is vital for brain health, and exercise helps keep your mind sharp and healthy. The American Heart Association recommends 30 minutes of physical activity daily. Exercise doesn't just help prevent heart disease, it also keeps your brain young and agile. Studies show that exercise improves memory and mental function. If you're not physically fit, try walking briskly for 20 minutes 3 times a week. Or take a class at your local gym. Or try dancing. Dancing boosts blood flow to the brain, making it work better. And dancing is fun. Eat right. Eating right is important for brain health. The foods we eat affect our moods, energy level, memory, concentration, and learning ability. Eating well helps keep us mentally sharp and physically fit. Stay hydrated. The brain is the most complex organ in our body, and we cannot live without water. We are born with brains that require constant hydration. A healthy diet and regular exercise help keep the body fit and strong. But when it comes to the brain, there is nothing more important than keeping it well fed. Our brain requires a steady supply of nutrients and oxygen to function effectively. If you deprive your brain of these essentials, it begins to deteriorate. Research shows that drinking 8 glasses of water daily may reduce dementia risk by 50%. So make sure you stay hydrated. Call 404-266-9115 today or click the link in the description to learn more. Please like and subscribe to our YouTube channel.